Now, the speaker tonight, I don't think has been introduced to many people, although he says, the only thing I want you to say about me is that I'm giving a talk tonight on my book, what's in my book, Child Health and Welfare in Newfoundland Before 1949, and only tell him I went to St. Bon's. He was educated at St. John's. His education stopped thereafter. The rest was only learning. His education was at St. Bon's, right? He had spent his whole career as a teaching physician and a practicing pediatrician at the Janeway Hospital and a Memorial University Medical School. He graduated from Dalhousie University Medical School. He wouldn't tell me when. Always admitting it now, 1969. And obtained his fellowship in the 1970s in pediatrics and thereafter worked at the Janeway Hospital. Now, he also studied infectious diseases at Case Western University in Cleveland, Ohio, and microbiology at the University of Toronto. He's now, after a long, distinguished career at the medical school, he's now a professor emeritus, and he retired as a full faculty member of the medical school in 2011. But as you can see, he's still using his knowledge and his practical experience to contribute more, not only to medicine, but to history of this province. By way of what people have recognized him and given recognition to what he's done, in 1914, he received the Silver Orator Award, which is given to the professor who has provided the best lectures with respect to content, style, humor, and aptness. He has previously received the Silver Orator Award for graduating class of 2005, 2001, 1996, and 1991. He was honored at the Royal College in 2014 as one of the Mentors of the Year in Atlantic Canada. In 2008, he received the Dr. Craig Lovey's Teaching Award, and in 2005, he received the Royal College Specialist of the Year for Atlantic Canada. He's always had a special interest in history, especially medical history. This is not his first publication. Those of you, I think, would have read his book on the Janeway Hospital. And I see several people here who worked with him during those years, and they know what goes into writing a book. All of us does. But to continue this interest says a lot about his drive, his energy, and his knowledge. So without going any further, I will say, with honor, actually, I introduce Dr. Rick Cooper, the speaker tonight.
Thank you, Paul. Can you hear me now? Is it on? No. Yeah, that's okay, but it's, can you hear me? You can't see me. Oh, good. Yep. Yep. Okay. 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 Good. So I had the opportunity to treat patients, and that's the part I love teaching, and I loved medicine, period. And I did see some adults going through as well, and I enjoyed that. But in fact, I had special training in infectious diseases, and I'd hear the older pediatricians say, "Oh, I remember that diphtheria. Yeah, we treated that, and so and it was really bad." He said the graveyard is full of the kids, and I said, that's terrible stuff. So I looked into some of it, and it's quite obvious that before Confederation, there was a lot going on that wasn't necessarily good for children. The children's life was in parts, but it was like that everywhere. Before 1800, there was children basically had no rights, and the poor weren't looked after. There was no orphanages really, and there was a lot of infectious diseases, epidemic infections like cholera, smallpox, and other infections that we now prevent with vaccines, such as, well, diphtheria, meningococcal disease, and different. So we're in a very safe period now, and I thought it couldn't get any better till along comes Mr. Kennedy, who wants to change everything and close down the CDC. I won't even go there. That's oh, I'm glad. I wouldn't talk to you if you were. Uh, but Newfoundland was different than the European children. First of all, the island, it was surrounded by all the codfish, and it was the migratory fishery was what the British wanted to use Newfoundland for. They stop off in the summertime and get fresh water, etc. And they discouraged immigration for centuries, except when John Guy and Lord Baltimore, I think was the first Lord Baltimore, came and set up colonies, which didn't work because of scurvy and lack of food during the winter, and these horrible winters we get with snow and rain together. It's so it wasn't. Despite that, in 1610, there was a few people that came from these communities stayed on. So there was some people with children in Newfoundland, and as the 18th century progressed, there was a few of them, particularly in St. John's, that were running loose. The orphans weren't looked after, and it was a dangerous place, filthy, dirty. We had the reputation for being the dirtiest city in the Western world, at least on the seaside. And so it was horrible for a child, but when you go and look at what was going on in Britain, in London, it wasn't that much better. But we, as a province, or not a province, a colony, had different issues. The migratory fisheries, the discouraging of immigration. Children lived in that did stay lived in isolated outports with no roads, phones, access to health care, etc. And that didn't change much over the years until we finally got some roads there and the railway. And the poor soil on the coastline meant that it was very difficult to grow crops, although many of the fishermen managed to do it. There were almost no schools, especially outside of St. John's, and many children before the 20th century, particularly in the outports, were illiterate. And that means as adults growing up, they couldn't read the contracts that they had with the merchants and on the truck system. Families relied heavily on organized religion, which started in 1800. The Catholics brought Father O'Donnell out, and the Anglicans had the Society for the Propagation of the Faith, and so religion did make a difference, a positive difference for the poor. And making it worse were all these penal laws in Ireland, and to get away from these penal laws, they tried to immigrate to North America, and their first stop was Newfoundland, and unfortunately the destitute ones had couldn't afford to go any further. So there was a lot of poor people pouring into the slums in the early 19th century, the 1810 around there and later. And when the credit gave out in the outports and you were destitute, so they'd come into St. John's hoping to find some work and survive, and they went lived in the slums with the rest, and that was quite a problem. So the other problem that we didn't mention was, besides violence and malnutrition, and was alcohol abuse, and this was a major problem before 1800. But with the arrival of the churches, and then later the fundamental faiths like the Methodists and Salvation Army, who condemned drinking alcohol, things improved, and the Catholics had societies for people that didn't want to drink anymore. So that part improved for the children. In the 18th century, the admirals ruled over the fisheries. They began in St. John's. They had no concept of cleanliness, and the slops from just to throw them out on the street. And eventually they had buckets, and they had night carts to come around. And the night carts were on the go in my day when I was a kid. And there's a fellow my age used to live down on Casey Street. And when he'd see the guys coming for the carts, he'd put rocks in people's stuff. And so they'd throw it in the big container, and it'd splash all over him in the street. I mean, this is filth of the worst kind. But this was the slums. And they're no longer here. Now they got the fancy hotels on the sites, but that's but there was here the schools always, they started here, and they were secular schools until the 1850s when Bishop Fleming and Bishop Field got into it, and they decided to have Catholic schools and Protestant schools, and that stayed until well into the 20th century. I think that there was some advantages to the denominational system for children. I mean, children identified with their religions, and they learned, what the rules were and what was right and wrong. But there was a lot of problems. Up in St. Anthony, Wilfred Grenfell said that they had, I think, 4 or 5 schools with 1 or 2 teachers, and about 15 or 20 children in each school, 1 for the Catholics, 1 for the Anglicans, 1 for the Salvation Army, etc. And so it didn't go well in the small outports. Not small outports, but even the bigger outports like St. Anthony, it wasn't good. By over late in the 19th century, a lot of industries were built in St. John's. They had tobacco factories, shipyards, etc. And the thing about the tobacco and the other industries, it was built because you could tax what was brought into the province or colony, but if it was made here, you didn't have to pay any tax. So it's a tariff system. And they're going on about these tariffs, and I'm not sure they work, but we had them here 100 years ago, and but it helped St. John's develop a very strong middle class, and they sent their children to the schools, and many of them did well and became lawyers and tradespeople. But there was an element in St. John's called the slums, and these were the poor people. That many of them didn't have any steady work, and they lived in utter filth, no water, no sewerage. And the slums were quite big. There was up like 1,200 units down there, and there was no water or sewerage, and they leaked, and they were dirty. There was rats and different horrible things around, and you couldn't have a garden because there was no land, except because the houses were on them, and they were built after the fires. And there was 5 or 6 fairly big fires. The worst was 1892, and there was other fires, I think, in 1845, with a lot of the people burnt. They had their houses burnt, but amazingly, there was very few people killed during these. But what happened with the fires is that when they went to build, there was no charter in St. John, so people just ran out 2 or 3 days later and started building these old shacks, houses, and with no fire prevention, nothing, just lay this wherever they could get a place. And this led to the slums being formed, and they didn't really disappear until 18 or 19 in 50s. Even then, there was still some around. And my cousin told me that he was delivering the mail, and he went into one place, and there was no floor in this slum house, and there was pans around collecting the water. So this is why that children died of infant mortality and other diseases, and there was no guarantee of food. There was no welfare system in the 100 years ago, so it was pretty hard if you were poor living in the slums in St. John's. And the outports was a little better. They had, yes, there was no money. They had a credit system, and most of them had no idea what they owed. But and there was no money at all. And on the paper, they were poor. But these people were were very smart. They may not be able to read or write, but they knew how to build boats, schooners, Rodneys, and smaller boats. And they built houses that were dry and clean, and they heated them with the wood stoves, and they cut the woods themselves in the wintertime, and they survived. And they had a very good family life. And there was one big problem. I know that Nurse Bennett in her book said, no matter what I did over my 50 years as practice as a nurse, I couldn't get through to them that tuberculosis is spread by people coughing, and children in crowded spaces will become infected. So she said no matter what, they would always have a kitchen party or get together in someone's house. And so that's maybe one of the reasons why there was so much infant mortality. So St. John's had their problems, and the outports had problems, but they were a bit different. Of course, in the outports, they were isolated. On the south coast, there was no roads at all. And even parts of the south coast, going up Fortune Bay, there's still no roads. And you have to get there by a boat. And there's mountains on the background, in the back, so you never get roads in anyway. Anyway, so what it left is all these people were isolated, and it was very different to get difficult to get any kind of help there, and yet the people survived and they stayed. Now, some of the diseases that they had, there was there was there was smallpox, which was very contagious, and the historians say it's the worst infection ever, with a very high mortality. And I think what frightened a lot of the well-to-do was that it didn't differentiate poor people or rich people or whatever. I think that the poor people got most of it, but still it was a disease that everyone got. And Queen Elizabeth I had smallpox as a child. And they came up with ideas. They had variolation. They'd find less severe strains and immunize children and keep them in these compounds for a few weeks, feed them and make sure they're well. And most of them had very mild smallpox and survived, but they were immunized with the wild strains of smallpox. And then Jenner, who was a family doctor and a botanist, noticed that and was told by the farmers that their girls didn't get smallpox because of milkmaids, because they didn't, they'd have these pustules from the cows, and then when the smallpox came, they didn't get it. So I think it was common knowledge about it. This wasn't something new. There was other people knew this, but Jenner followed through on this, and he started to immunize a few children, including his own son, and he wouldn't get away with that today, but anyway, he did. So, and there was an epidemic a few years later, and all the kids he immunized didn't get infected. So people like Napoleon found out about this and immunized every soldier he had, and not one soldier got infected. And the same with the British Navy and others. They demanded that if you joined the Navy, or if you were caught and made to go in the Navy, you had to be immunized with the smallpox vaccine. So it was successful where it was used, but there was a lot of conscientious objectors. People that owned the variolation clinics lost all their business. So, and people said, oh, you start growing horns on your head and stuff like that. They didn't know about autism, but they would have blamed that as well. But so just to mention about smallpox, about the vaccines, and that there was an awful lot of vaccine objections to it, and I called them the Flat Earth Society, and I think that Mr. Kennedy is going to be the chief president of it. The other infections that we had are, I should be checking also.
That's okay. Did you want to use your slides?
Yeah, well, yeah, I can, yeah. But just on the ones.
Just come out. Second.
So the other infection was cholera, and cholera is still seen today, and it's transmitted in water, in contaminated water, and the problem is with it, it doesn't damage the gut, but it produces this toxin that causes the gut to excrete enormous amounts of fluid. So someone that has an active case of cholera, an adult, can pass 20 liters of water in 24 hours. And so today that would be treated by intravenous fluids, and now they have these oral hydration fluids that you can use when there's no intravenous, and the survival is much better. However, the the deaths in 1845, when there was an epidemic in Europe, thanks, yeah. I'll get, yeah, thank you. In 1845, there were 400 deaths in St. John's from cholera. In 1854, 900 deaths in St. John's. Now, St. John's was no metropolis in 1854. Maybe, I don't know, 8 or 9,000 people, but 500, and most of the 900 died of cholera. And most of those were children. And they're long forgotten, but I mean, those numbers were, I know that it was so bad that when it was all over, Bishop Mullick had a high mass in the Basilica thanking God for stopping this terrible epidemic. And typhus was another one. There's a different type of bacteria. It's rickettsia. It's a different kind of bacteria with a 40% mortality, but you have to be infected with body lice to get it. So the upper class people in St. John's didn't have anything to worry about because they weren't lousy. But these poor people were, and they came over from Ireland in the ships and with no food, and they were infected with the body louse that would carry the typhus. And they built that hospital up where Victoria Park is in I think about 1810, around there. And that's where most of the typhus cases ended up. And there was 40% mortality, which sounds a bit high, but diphtheria was a big problem, and typhoid as well. Now, typhoid is it's caused by Salmonella typhi, and so it was the typhoid caused high fevers, and it could cause abscesses and whatnot. And it had a fairly high, if it was untreated, there was a high mortality. And there was an epidemic out in Manuel's and in a Catholic orphanage, a boys' orphanage, and several of the children died, but Father Morris, I think, who had very influential family here himself, and he looked after the children and became infected himself and died from it. So these are epidemics that shouldn't have occurred. There was no quarantine. We had the best quarantine laws. The first thing when we got representative government in 1832 was write up the quarantine laws. 20 pages, I saw them. They're great. They're good. Except no one ever followed up on them because there was no money. So they had the laws, but there's no sense having laws if they're not going to be supported and controlled. Unlike Halifax had Lawler's Island for over 100 years, so all the ships were stopped coming into Halifax by the small boats, and someone would go aboard and ask, what are the passengers like? Is anyone sick? And if there was, they had to go to the quarantine station. And that closed, I think, in 1928. So there wasn't a lot of typhoid or cholera in Halifax because they had a good quarantine station. Infant mortality is a huge issue here. And infant mortality, you could say a lot about it, but one thing about if the country has a low infant mortality, it means that they're probably doing pretty well. They have good storage, they have good health care, and they're prosperous probably. by being prosperous, there was plenty of work, and people had money, and they had the right kinds of foods, etc. So infant mortality was a major problem in Newfoundland when we started keeping statistics, when Dr. Brehm set it up, and I think they were fairly accurate by 1900. They were started in 1895. The cases of tuberculosis and infant deaths was very high, and they in England they found that it was high in the 1850s when they started keeping statistics, and they got kind of concerned because they noticed that the the birth rate was declining, but the infant mortality was going up. And infant mortality is a death from the first, after you take the first breath when you're born till you reach your first birthday. And so the normal in prehistoric times, the numbers be about 300 per 1,000 births. And England was recording about 160, 170, which was really high, and they got very concerned. Now, why were they concerned? Were they concerned about the poor families that lost these babies? No, not really. They were concerned that when the next big war came along, they wouldn't have enough soldiers. So, and this is true. So they said, we got to do something about it. And common sense, the public health nurses became involved. They taught, they had food supplements, and women pregnant women could go to these clinics and work. Infant mortality dropped quite a bit, not down to but it went down into well below 100. But Newfoundland didn't get this kind of attention until 1920, when the children's they started the child health clinics, and these were people worked at it very hard. They had excellent boards, and that made a difference in St. John's. But they're only 40 years behind some of the other places. But and it was interesting that in 1910, the number of infant deaths per 1,000 was much higher in St. John's than it was in the outports. But this was reversed when they started the well baby clinics and offering encourage the mothers to use milk. Of course, one thing that they kept shouting over and over again, not shouting, but teaching, you must breastfeed if you can. And the breastfed children have much more protection than bottle-fed babies. So they encouraged that, and breastfed babies would have an infant mortality much, much lower than babies that were bottle-fed or just cow's milk, because they didn't know about pasteurization, and the cow's milk was not that safe. So they kept up their clinics, and with the Commissioner government in 1936 took over the clinics, and but the infant mortality didn't drop down enough. And it was still because the slums and the isolation and poverty in the outports. So although there was a lot of improvements, there was immunizations in by now for stuff for diphtheria, and there was more knowledge, and nurses were teaching them. But you can teach someone off from dawn till dark, but if those children aren't being fed properly or misfed or given contaminated milk, you're not going to lower the infant mortality. So, but if you breastfeed your baby and stay well yourself, uh, they they do much better. Tuberculosis, just I have to include. Everyone thinks that's an adult problem. It's not. It's everybody's problem because it's extremely contagious, and it was a major threat in the 20th century. And there was epidemics in Europe in the all through the 19th century and 1800s. But in Newfoundland, we didn't know about it until they started collating statistics. So they really didn't do that till about 1895, and it became more accurate in the 20th century. And the TB cases were way above what other people were seeing in other provinces and other countries. And so, but children can be infected at any time and were being infected. Some of them got miliary TB, and others. I'm not doing very well with the slides, but anyway, that's. So this is on the bottom right. Is a child with miliary TB, a younger person, and it looks like millet seeds, and that means that the organism is spread all over your body. And in the before streptomycin, the mortality would have been close to 100%. Now, the problem is that someone that has, they call it cheese-like abscess, that finally gets broken down and it's filled with air and pus. So every time they cough, they fly out these billions, trillions of MTB bacteria into the environment. And if you've got a kitchen party on the go and Uncle Fred comes in and he's coughing and coughing, and then there's 5 or 6 children, well, guess what? The 5 or 6 children are going to get infected. Many of them did not get active TB, but they had latent TB. They were infected, but didn't have symptoms. However, some did and have symptoms and they died. And they're more likely to get pneumonia or the miliary TB, which was horrible. And I've seen it, this TB meningitis. And when I was an intern, I can still hear this man scream with the pain from the TB meningitis he had. And it was absolutely horrible. I guess it wasn't our patient, but there was some delay. I think he was in the water for something. And anyway, the aminoglycosides, streptomycin was introduced in I think it was not, you could get it at 1948, and the Newfoundland government paid for it. And this dropped the TB numbers way down. And everything that the Newfoundland government could do and did do may have helped the education, good food, and even giving food to the children in school. The sanatoriums, there's still controversy, but I'm sure that helped, at least that it got the patients that they had, they became well nourished and they could fight their infection much better. And as you know, there was a lot of sanatorium beds in this province until the mid 20th century and later. The Commission of Governments was after the First World War, when Newfoundland gave out all the money which they had borrowed to the British government, and paid for a very active, well-trained unit to go over and fight. And they ended up owing about $14 million of borrowed money. And the railway was a lovely little railway for about 100 years, and not 1 year did it make any money. So that was, and there was a lot of poverty, and there was bad years with the fisheries. So the budget was bad. So we were, and Squires was the Prime Minister of Newfoundland at the time, and he was the one that there was someone in charge for a while, but at the end of the day, the Newfoundland government agreed to have a commission of government, and that was with 3 British commissioners and 3 Newfoundland commissioners, with the governor as 7 people, and they had total control politically of the province. And one thing they did, there was a lot of good things and some not so good, but they made healthcare a priority, including TB prevention. They built more sanatorium beds. They built cottage hospitals, nursing stations. They built a ship, or bought a ship, the Lady Anderson, which went around, and they had regional nurses and food supplements in school. And this, however, did not make a big impact on infant and child mortality. Well, you can treat and do everything you can medically, but if that child is not well nourished and is starving, they're not going to get better. So the Department of Health and Welfare, Dr. Mosdell was the secretary, and Mr. Was I think Potter? Yeah, was the commissioner, and they decided that they wouldn't, they weren't going to get involved with health, welfare issues. If people were hungry, they can go out and work, and that just didn't make sense because a lot of them are dying of TB and whatever. But Dr. Mosdell in the 1920s for the government, he was on the government himself, and he came up with these recommendations to help Newfoundland with healthcare, and that was wonderful and was good. It was a great start. And there were the expanded hospitals in St. John's. They were there. They were doing X-rays on people and diagnosing tuberculosis more, but they didn't have the money to improve the welfare of people, and therefore the infant mortality and child mortality stayed up. And poverty, just a couple of things about it. It's, it was poor, but one of the reasons for being poor, we only had one industry in the province. We're not like Nova Scotia. We did have a mine or two, but they had coal mines, beautiful farm country, and fishing. Whereas Newfoundland basically had, most of the Newfoundlanders were fishing. And but one of the commissioners said that he was an economist in England before he came out, and he said that the fisheries is only worth about $6 million, and half of that goes to administration and the merchants, etc., and the other half goes to about 1,200 fishermen. And he figured out that the fishermen probably got about $50 a year from all the fishing. And in the meantime, there's all these people fishing, and they were sure the fisheries, the fish numbers dropped. And so not only was it a one industry town, that industry or province or colony, the numbers of fish were diminishing and were making matters a lot worse. And this is just uh, uh, a story about two nations. There's a book about it Disraeli wrote, and and this was certainly true in St. John's. And the poor were smelly and dirty, and they shouldn't be around. There was complaints in one of the churches in the city that when the wind changed, the smell in the summertime came up from these slums, and they were bitterly complaining they couldn't go to church, or when they did, it was a smell. And but they didn't. Why is there a smell? There's no water or storage. There's no one decent. And one of the bishops, Bishop Roach, knew this, and he was down looking around. He's a Catholic archbishop, and he said, so he wrote a letter in April 1917 to the people saying that, look, between you, some of you have money, you're good people, but you must help us get new housing for these poor people in the slums with water and sewerage. Nothing happened. So he repeated the letter a year or two later, and with the same, and with saying, describing what it was like down there. Nothing happened. So that's two nations certainly existed here, and I think that the social standard people, there was problems with people thought that they were aristocrats, and some of the commissioners knows that who the hell do these people think they are? Aristocrat is someone that with a couple of thousand acres of farmland in England, and they're quite wealthy. These people, own the fish plant or something, and they think they're so. And I think that's they didn't work as a community like they would more today. At least I hope today. At least certainly Kearney and wants to have us all together. There was improvements made over the years. There was more schools, and schools were really, really important, as you know. And no one mentions it, but I think the religions made a great impact on the welfare of children with their education and their trying to get them to do the right thing. It's a sin to go stealing, and etc. And then there was a Reformation centuries ago, but it gradually came down in the 19th century that the British realized that children had no rights, and that into the early part of the 20th century, there was rules and laws for children's rights. And it was after the First World War. It didn't go far, but the United Nations had one in the 60s and 70s, and it's had 38 recommendations, I think, and that's still on the go, and Canada became part of it. And we have, I used to find it helpful when I was dealing with certain families, and social workers were trying to protect them. And they lived in Labrador, and I said, do these children have do they have their rights? And the answer was no. Well, that's what I'm saying, that you need to do something. So there's still a lot of yes. That's anyway. I'll leave. So there's still certainly in the early 19th century, earlier 19th, Bishop Governor Waldegrave, which has a street named after him, just coming up from the waterfront in St. John's, and he was appalled by the children and the poverty when he came here in about 1797, I think, and he took some of his own money and started some things for the destitute poor, and the organizations, the Protestant and Catholic, started opening schools. And as I said, the schools were for anybody that could come. But by 1850s, the Catholics and the Protestants had their own schools, and that stayed around until I think 1980 something. Anyway, so we're getting close to the end, and I wanted to open it up to questions. But just to say that, in conclusion, yes, there was a lot of problems, and there are still some of those problems around. We have a very good immunization service, and up until recently, the levels were very, very high. We can have 97%, and in parts of the United States is down to 70%. And this man, anyway, I get a little bit upset with what's going on, but people said you should stop looking at it and think of something else. Maybe that's a good idea, but one of the things I wanted to say that, yes, a lot of things improved, even from the 19th century. There was gradual improvement, but most of these changes weren't bigger doctors' offices or access to, they were public health. When you put in, make sure your water is clean and there's proper sewage disposal, and there's surveillance that if a child, we're immunizing, but we have our feelers out. They have physicians that go and measure the number of cases. These are much more important than, if you're looking at someone was in part of Africa, and the British wanted to donate $10 million in the 60s. And they said, what do you want to do with the $60 million? And the physicians there were very wise. The British wanted them to have a neonatal intensive care unit so that babies would survive. They said, no, we want a good immunization program. And that's where they put their money. And I think that's, I, at the time, and still do agree with that. I remember pasteurization was like in 1957, we started pasteurizing milk. We should have started in 1857, but anyway. But things improve, but there are some problems still, of course. Of course, the biggest problem are these damn video games. But when you see kids going now on the street, they got the phones going, they're talking away. If I was walking home from St. Bon's in the 50s and someone was talking to them on the street and there's no one around them, I mean, I'd call someone and get them put in the water for it. But now that's what they do. So there's lots of community support. I think that the strong faith is not there, and we have drug abuse and stuff. But still, my father, when he was a teenager, wanted to be a doctor. And his family was, they were good providers, but they didn't have any extra money. So he could not go to medical school. He was very smart, very intelligent. And so he became a chartered accountant and did well with it. But today, there would be no problem. He could apply to medical school. He was smart, he would have got in, and he would have made tremendous contributions to healthcare, maybe in public health, who knows, or be a surgeon. Anyway, so those things are still there. When I was teaching at Mon, students didn't know I knew, but they were reared up in under social assistance, and some of them, the odd one was in medical school, which was wonderful, and but a lot did social work and nursing, and it was tremendous. So things are improved, but there are still problems out there. But I think that since 1950, things kept moving, and by the 80s, things were not perfect, but they were much, much better. So I'll leave it there, and I'm hoping that there'll be some questions. So thank you.
Talk a bit more.
Yeah.
Okay, thank you very, very much. It's very informative. It's almost 200 years of history in 45 minutes. That's pretty good. Or an hour. Any questions from the room here or online? Rick says he wants some comments, only good ones. Any questions? Yes, just a minute now. We'll give you the microphone.
My husband was diagnosed. Well, he was a volunteer at the Veterans Pavilion, and they brought in a policy that you had to get a TB clearance. And he'd already been a volunteer for a couple of years. But anyway, he got the TB scratch, and he came home and it looked quite sore. And I phoned the hospital and they said, no, that's normal. But then it started kind of traveling up his arm. And there was a storm coming in, and I called my son and said, come and take him to the hospital. And the doctor took a pen and made a mark around. He said, if it crosses that mark, you get back here quickly. But he apparently was a carrier.
Oh, yeah.
And because he got the scratch, then it developed. I guess it would have gone to TB.
No, that's very common, and we have to tell that when we go to when I was moving to somewhere else, the first thing they wanted to do is one of those tests. I said, well, I won't be able to come to work for 3 or 4 days because my arm will all be so. And usually that was enough, but that's common, and usually that's just a reaction, overreaction to the tuberculin that's injected into the 5 tuberculin units that they see, and but I think more on a good history is they don't always do, but in Newfoundland. In my day, just about everybody had a positive test, and it's natural. And my brother got something, I don't know where he got it, but he had some kind of TB. And my mother was, oh, geez, only poor people get TB. No. It's not like that at all. I mean, lots of rich people get it. Anyway. So it was all over the place. So if you're my age, most people still have the positive test, and they don't need and shouldn't get the 5 tuberculin unit, I don't think, because they can get quite a reaction. But I don't know if Dr. Bridger agrees with me. She's still here.
Shake your head yes and agrees.
She agrees. Good.
When did babies start being delivered at hospitals in Newfoundland?
When it started in the in the 20th century, probably in the 20s and 30s, and I don't think that was necessarily a good thing. What was important, and this province doesn't have it, we don't have midwives, and I'm not talking about a nurse that goes out in the district that had training as a midwife. I'm talking about women that had 3 or 4 years, or a nurse first. My wife, Grace, is a fully trained midwife from Scotland. And these people do much better delivering babies, I think. And doctors are too busy. And, people in the US looked at this. They looked at poor women who had midwives, and upper class or middle class women that had doctors, and the midwives do much better. And I think that that's putting them in a hospital. Yes, it was good. It certainly lowers, the chances. And I'm not saying it's wrong, but the idea of getting the baby delivered and get the family out of there in a day or two was good. I know when I was born, we had to stay for 10 days in the hospital. For what? I don't know. Pick up some bad bugs, I guess. So, but that's, by the 50s, I think most of the babies were being delivered in hospital. But I'm not promoting home deliveries, but they can be done, and it can be done safely, have proper backup, particularly in big cities, in Glasgow or London, places like that. But that's another story.
Well, just further to that, in Rick's book, he shows a picture of the Grace, which was the first maternity hospital, and that was 1923.
Yeah.
So that was the first maternity ward, had wards in it with bassinets and full service for newborns.
But Grace did a lot. They set up, they had courses for women that wanted to be midwives, and they taught them the basics, and it was certainly a very good service they were treating. And some of them went on to be nurses after, but I think the combination of nurse and a midwife who dedicates her life to that is good. But in the outports, you can't get a lot of midwives, so it's important. Some they call them I think granny midwives. There's a name on them, but they are people with common sense and good training, and they deliver babies. But they're not, quotes, medical people, but they did very well. And there's a book written by Lady Brown. I think there was 80. She talks about 80 women that did this, and it was published about 2 years ago. Anyway.
Just to add to that, the first course, I think, was 18 months long. And it's interesting that the nurse graduates at the General didn't do any maternity until the late 1920s. And then they used to send them over to the Grace to get some basic training. And St. Clair, so that was later on. They started theirs in 1929, I think it was, whereas the Grace started in 20. Yeah.
Anyway, any other disagreements? Yes, sir.
Thank you. I'd like to get Dr. Cooper's view on the antiseptic environment that we find kids in today and the allergies that they have in abundance versus my own growing up as a kid in Outport, Newfoundland, where we literally played in the dirt. Now, I know it goes against some of the things you've said about the spread of disease and so on, but I'd like to hear what you have to say about that environment as to its goodness and its badness.
I think it's good because there's several studies being done now, and I first agreed with you. In fact, I was taught by Dr. Coward in Halifax. My first rotation as in child health was as an intern. And I said, Dr. Coward, I know nothing about infant feeding and stuff. Well, here's what you do. And he listed all these items. And So I said, good. And a few nights later, there was a big storm, and this woman walked in with a baby and a 3-year-old with an ear infection. So we treated the ear infection. And she says, can you check my baby? He's, I think, was 6 months old. And I said, my God, that's a thriving baby. I said, what do you feed him? She says, everything. And I said, hold on now, Dr. Coward. What do you mean by everything? I said, meat and potatoes? Yep. I said, how do you get meat? When did you start? As soon as he was born. Well, how'd you get meat and potatoes in? Well, I chose it up and spit it into the baby. And I took out, I remember taking out Dr. Coward's recommendations. So women had come along to me and said, what about feeding? I said, what the public health nurse? I said, look, every baby is different. That's all I can tell you. And use your common sense. But that's true. Later studies in the Korean, no, in the Vietnam War, they had 2 regiments. One regiment went out and they had showers in where they were fighting, and they had to get at least 1 shower a day. There was all kinds of, they changed their clothes. Another one regiment, a few miles away, stayed dirty. And they looked at the wounds from the 2 groups. And who do you think had the most infections? The antiseptic ones that they were clean. So there's some, people ignore, and I think they're starting to realize more and more, we all have what we call normal flora. And if you take an antibiotic, that can upset the flora, and you can get some pretty bad actors in your gut. So that antibiotics can, but sometimes you need the antibiotics, but if you overuse antibiotics, you're going to get some pretty resistant bad bacteria that are selected out. So, and so I agree with you, and that's another, yeah, Chuck.
That reminds me of a story that was written up in one of the history books just for it, that one of the nurses, this appears in one of the books, I'm not sure which, nursing history, she was trying to teach the people about tuberculosis and to keep the people who had tuberculosis away from the children. And she went into this house one day, and the grandfather was chewing the food, who had TB, and was feeding it to the child.
I think that was Nurse Ben.
And it was, yeah, that'll tell you the level that it went to. Interesting. Now, another question?
No, go ahead. Someone else? You go ahead first. Oh.
Well, Rick, I've known you from day one of your residency at the Children's Hospital, the old Children's Hospital in Halifax. That was the first time we met. So that's more than 55 years ago.
That,
And our friendship, of course, is
56.
a rock one. But just to tell you that we admire you for all what you have represented. You're referring to Mr. Kennedy down south, and your antithesis of this man in terms of knowledge, practicality, common sense, decency, care for people, genuine care. And what you have done in a career spanning from 1969 onward is truly remarkable. You deserve, after serving as the chair of the department for longer than any other chair, you deserve all what you accomplished in regard to recognition. I thank you for what you are, what you have done, and who you are.
That's
We are
very
proud
kind.
of you.
Thank you. Right.
Dr. Cooper, Dr. Cooper was my student.
I didn't pay him to say that.
Dr. Cooper was my student, and then became my colleague, and then became my boss.
But one of the
And
things,
thank you for all your steps toward me.
one of the important things to do if you take something on, whether it's neonatology, is that you train, you watch out for the good students and and see if they're interested in pediatrics. And I asked one student, was she interested in infectious diseases? And she said, oh, yes. And we got her fellowships and training, and she's sitting right behind you now with a smile. And she's the chief. They changed all the titles last, but she's the chief now of infectious diseases as a physician in the provincial healthcare. Is that right? And doing a great job. So, but that's what makes you feel good when you see people come behind you and do. I used to say that my kids are smarter than me, and that's wonderful, and they've done well. So, and they take after their mother.
Thank you for your talk. I'm just wondering, how are we doing with infant mortality? Prehistoric, I think.
Oh yeah, sure.
Are we doing okay?
We're doing very well, I think. It's about 5 per thousand now, around there, 4 or 5, no, more than 4. But and most of the deaths are, I think at least they were, are unpreventable. That they may have anencephaly or something. But it's way down, and we're equivalent to other places and much lower than parts of the United States.
Okay.
Which is important. I think people, there's a little, anyway, but let's leave them out of it tonight.
Thank you.
Anyone else?
Anybody else?
Anyone else got any agreements? And I see, okay, I won't embarrass anyone. But
No, and by the way, I saw you slip that $20 to him before you came in. Anyway, thank you very, very much. Very interesting, but it also brings forth something that has not really been studied a lot in history.
Never been written up.
Medical history in Newfoundland is still a lot to be written. But this is a start, and an interesting start, and a comprehensive start to the aspect of infant mortality. How many of us wouldn't be here today if it wasn't for the improvement in infant mortality in this country? There's very few here over 75. So if you'd have been born in the 1920s or 1910, how many of you would be here today? That's a question you have to ask. In other words, it's been extremely important to our population, to everything in our society, that this has been bettered and is now under control. And we're as good as everybody else and better than many others. So thank you very much, Rick, for your very interesting talk and your wonderful book.